In today's event, we're going to talk about how we can do better bringing care to patients with rare diseases in under-resourced communities and countries.
I'll also mention that, while we typically have focused on patients with rare diseases who also live in communities where they may not have access to traditional services when we talk about utilization of services in underserved, but we also recognize that those patients who live with rare diseases may also be members of communities that could be defined potentially as not having those access to services, and thus themselves could really be considered underserved in some ways by definition. And so there is that broadening out of the thinking about the access to services and the utilization of services. And additionally to the wonderful comments that Consuelo mentioned about potentially the way in which we think about marginalized populations.
There are only about 5% of rare diseases that even have treatment options. So another broad challenge faced by rare diseases is the fact that by and large, there are no treatments that have been approved. And so the care that they can access consists of, leveraging treatments for symptom mitigation that might be used in other conditions, or the fact that they may not even be able to do that because the specialist care is not available for many rare disease patients. So we can go into more depth in any one of these areas, but I think the fact that we have a long diagnostic odyssey, that we have care that's inaccessible from specialists because there's simply very few specialists in many rare diseases. We now are thinking there's, generally people talk about over 7,000 rare diseases, but more and more evidence is coming to light that there's actually over 10,000, and more are identified every day. So, the patients facing rare disease diagnoses are trying to navigate a system that is definitely not built for that level of specialty care, and certainly not if they're living in rural areas not already connected in with the healthcare systems.
For patients of color in particular, the diagnostic odyssey, as we call it, can be on average 7 to 12 years. And partly this has to do with access, but part of it is their relationship with their providers. Oftentimes providers or patients of color don't think about rare diseases. And I think that may be true in general. I mean, it's rare, but it may not occur to providers. But we have a couple of examples through the RDDC of patients. There's one who comes to mind. A man was diagnosed with cystic fibrosis at the age of 52 after decades of symptoms. It took that long for providers to finally decide that this might be cystic fibrosis.
And I would also, echo Linda's earlier point about some of this being intentional. So we do not want to, dismiss or forget that, racism, discrimination, bias built these systems that we're talking about. And these are the same systems that, historically excluded people from research, excluded people from high quality healthcare, segregated care. Like, all of these things are built into the foundation of healthcare delivery and research. So that can't be forgotten. We can't just, presume that people don't want to participate, that they're not being invited, but also we have to recognize our role as researchers and clinicians and systems builders and political elected officials, everybody's role in what we've created here.